Hey, it's Jessica DaMassa with WTF Health. I'm here at AHIP's Consumer Experience and Digital Health Forum, and joining me right now, I have Bill Evans. He is the Managing Director of Rock Health. So Bill, good to have you here.
Yeah, really good to be here.
All right, so Rock Health, I love to follow what you guys are doing because you're like tracking the digital health industry, the health technology industry. You guys publish the digital health funding report. You guys publish a number of other surveys that look at consumer adoption. So I'm gonna pick your brain about what's going on in health and technology and digital health right now. So what's trending? What's everybody investing in?
Sure, great question. So you're right. We look at digital health's investment each quarter, and then we true it up every year. We're about to publish our annual thing in a couple of weeks, so stay tuned for that. Yep. But one of the things that we look for is we categorize in a couple different ways. So there's a bunch of ways to answer your question. Mm-hmm. I'll do it the simplest way, which is sort of what are the most interesting technologies is probably the one area, and then the other would be what are the most interesting business models or at least value propositions? What are people trying to solve for? And right now, I think there's a couple of big technology areas that shouldn't be a big surprise to anyone following this, but it's AI and machine learning and telemedicine have been on top for a long, long time. The last 6-7 years, they continue throughout to be really big areas. And then the other is to talk about sort of the conditions that are of greatest interest to investors. Chronic care is still, and you know, things around obesity, diabetes management, metabolic disorder are really big. But cardiovascular is a big up and coming area. And there are a few others I think are more specialized and specialty conditions are getting more attention now. Okay,
now you laid in there the business model thing that everybody is investing in. So beyond conditions and stuff. So I'm like, I've talked to so many startups and so many of them are like, oh, well, we're going after the health plans and we're a per member per month model. And it's like, come up with something else. So what business models are investors hot in? And I mean, we're talking about investors, not only VC investors, right? We're talking about angels, we're talking about institutional investors, right? We're talking about that big pool. So what are they interested in business model wise?
Yeah, sure. Well, there's a couple levels to answer that. The biggest is just B2B versus direct to consumer. And in healthcare, when we did this research about a year ago, about 85% of all companies in digital health are B2B. So business to business is the business of digital health. And you have to be able to sell to plans, to providers, to biopharma increasingly. I think that's an emerging area. And so the second part of your question is really about, is it all PMPM? I think not. I think that you want to match the way you go to market and the way you sell with the primary consumer. So if you're selling to plans, be PMPM in the way you commercialize. Otherwise, the plan's going to have a hard time, right, fitting it in. But if it's a service line for a provider, then by all means, you know, match the contracts and the structure so that you're delivering something that they know how to budget for. It aligns with the way they spend money. And I think that third area, biopharma that I mentioned, so payers, providers, biopharma are really coming into care management increasingly, and what we're seeing are they have a lot of pressure on their business model. There's a lot of commodification of drugs, and R&D spend keeps going up with not a lot more to show for it in many of the pipelines. So they're coming at digital health with a new lens, and that's an exciting area where I don't know that the answer yet exists fully.
I'm curious about checking a couple trends with you, can I?
Yeah, sure.
All right, cool. Okay, so one of the things that I keep hearing over and over again is that VC funds in particular are very interested in platform solutions and very interested in things that take on admin expense. Are you seeing a similar trend?
So platform means a lot of different...
Oh my God, everybody's got a platform.
Yeah, right. So then there's the platforms of platforms and things like that. But I'll tell you where I think the word platform can have real meaning and value in healthcare. Two areas. The first would be in sort of benefits administration inside of employers today. What they face when they're trying to buy solutions, digital health solutions in particular, is just this sea of things that are out there, really great solutions that may not all fit together. So platform plays like our investment in Collective Health, where it's a TPA, third-party administrator, but part of their secret sauce is that they can bring together and stitch together the consumer experience, the employee experience for the digital health offerings that the employer wants to make available. They can also measure and manage kind of the KPIs around those things more effectively too. So that's sort of one way that I think the platform really has a lot of meaning right now in healthcare.
Yeah. The other trend I wanted to check with you is it seems like there's a bit of a shakeout with some of these one-trick pony apps, let's call them. And so it seems like there was like 2 years ago, there was like a digital health startup that did like every manner of everything for every disease condition in a very specific patient population. And since then, it seems like things are starting to collapse. And the startup community, you're seeing bigger rounds, later rounds of certain companies that seem to have like dug themselves in. And then we're seeing some of these other companies that were once angel funded unable to close the next round and move on. Are you guys seeing that too, that collapse? And if so, like what are some of the things that seem to be disappearing? Like what startups are kind of going away?
Yeah. So I'll answer this first kind of from the data, right?
Yeah,
so I'm a data nerd at heart.
I love that.
So one of the things we look at around funding is exits. And exits are simple in the right now in the sense that there have been no digital health IPOs in the past 2 years. So this is all about M&A. And when you look at M&A, what you see pretty quickly is that the primary acquirer of digital health solutions right now are other digital health solutions. So this consolidation, which I think is what you mean by collapse,
Well, yeah.
as opposed to industry collapse.
No, I did not mean industry collapse. I'm meaning like things are like collapsing into one another.
Yeah. So this consolidation, that thesis, that's borne out in the data right now.
Okay.
Right, and so that's data driven, but I think the other part that is probably more interesting is sort of, well, so what? What does that mean, or what kinds of things should we expect to see being folded in? And really, it folds in the folding in, the consolidation is happening around clinical as well as around operational.
Okay.
So if you think of it clinical as point solutions that you might be referring to, things that investors were excited about 6-7 years ago for a particular condition or treatment, those make a lot more sense to be rolled up into something else that's going to really, when the provider, let's say if it's provider facing, is going to be able to buy once and buy a suite of solutions, and then likewise on the other side as well.
I want to talk about the consumer for a minute because I know you guys study them as well. So what are we seeing as far as healthcare consumers and adoption of digital therapeutics, digital health technology? I mean, are they buying this? Like, and I know not buying it because a lot of them, it's like, I mean, they're not actually like turning over money, but I mean, like, are they? I feel like I have to be very specific now with the word choices that I'm making here. You will give me grief. So are they adopting these things the way that the companies that are putting these solutions out there hope they would be, or that even these larger companies that are backing them, or the investors or the healthcare system that they want to see the engagement, is that netting out, or are consumers like, no?
Yeah, well, it depends. So some stuff, yes.
What stuff?
Yeah, so the simplest, like high adoption technology solutions out there are health information. Consumers love to go online to get information about their health, their well-being, and then where to go when they need help. Okay. So about 8 out of 10 people in America that we, in our surveys are not perfect. There's a plus or minus on these error bars. But when you get to 80%, it's like pretty much everyone does that. Okay. And then what we look at are sort of the segments where the adoption is lower, and what we want to understand is where's it going to go, right? If it's low and rising or low and stuck. And so, for example, video-based telemedicine is low and rising slowly, which is counterintuitive to a lot of the people that we talk to.
Yeah, because everybody's like, everybody's on telemedicine.
Right, sure. So video-based telemedicine, and I want to differentiate that from over the phone, text messaging, email. Email is hugely popular if you lump that into like sort of telehealth. Text-based is really popular. Video is not, which makes sense in some ways. People just like to be quick about a lot of easy questions. Sure. But kind of the purpose, I'll back up, sort of the purpose for us in doing all this is to, I think, understand it well as an investor ideally. But one of the things we want to do is publish on it pretty rigorously and put it out there. We want everyone to sort of see what we're seeing. Yeah. And then we want our portfolio and the folks who work with us as startups to get access to these raw data so that they can go and use it in their business and make use of it. Because right now, this question about like who's using.
Yeah, because I mean, like really, like is it really as ubiquitously used as some out there that are in the innovation community would like you to believe that it's being used? Like, I mean, is that true or not?
Yeah. So, I mean, broadly, sometimes.
Sometimes. It depends what it is, right?
Yeah. And then the other way we look at it, so we look at it by technology, like I was just saying. And then the other is, let's segment, and we sort of build personas of people that we think represent important populations. So we have a group that we call the worried well in our research, and we define that as a certain youngish age group that have reasonably high incomes and so on. And we ask the question, sort of, what are they doing around digital health? And what you find is that the populations that have, in some cases, the best health are higher adopters of some of these tools, which isn't terribly surprising. When you look at older populations who are in greater need and they report more comorbidities, what we find are that they are higher adopters if their physicians are a part of the process. Okay. So when their doctors are telling them, hey, this is a really good thing, get on your, you got an iPhone, great, try it out. Yeah. Or give me a call on these, things. There's much better adoption. When there isn't physician involved, we see lower adoption still. So there's some really interesting signals about, hey, it's low adoption, but you can fix that if you've got the right tactics in place.
Okay, so I know you guys are investors, and I love to ask investors, so what do you got your eye on coming out the gate here in the new year? What's hot right now as far as investing into digital health companies or digital therapeutic companies or however you want to call them? I mean, the names, you just keep going on and on and on here.
Yeah. Well, so we're easy. We're an easy read. We publish what we care about. Well, yeah. I mean, I know that in other, kind of investing, you want to play your cards close. I think in healthcare, collaboration is how you win. Totally. There's just so much that it has to come together. So we just published, and as a coincidence, invested almost at the same time that we published on substance abuse disorder. Okay. So we think this is a really important part of healthcare. There's huge opportunity. There's actually a lot of waste around how substance abuse disorder is treated right now. Okay. So we published kind of what we think about that. We think this is a really important area, one where a lot of value is just, and then we invested in a company called Marigold, where they're doing really clinically based, validated and studied, based on studies done before them, and then doing their own studies to validate how they go about treating substance abuse disorder. And then that's all very software enabled, right? So there's a lot of leverage out of that, and then a lot of value creation that they have in their model, we think.
In terms of the kinds of solutions that are coming out, is there an area that's hot there? And by that I mean, are you hot on things that are going to engage with patients? Are you hot on things that are helping reduce admin spend? Are you hot on things that are helping improve insurance and the payment model and that kind of system? Is there any, when we look at those kinds of categories, if you slice it that way, is there anything that you're hot on there?
Yeah, so let me kind of pull in a technology combination around this. So, for example, when we look at AI-based technologies right now, one of the things we're most interested in is how do you improve either hospital or plan administration with AI technology. We think that's pretty low risk, pretty high value, and there's a lot of administration opportunity. And we've made investments in that space as well, I should add. But I think that's an area where we see still, the problems have not all been solved yet.
All right, Bill, I got to ask, what's not hot? What are you not hot on anymore?
You stole it from me a minute ago, where I think that what we as a community, digital health, founders, investors, consumers of it, and everybody, what we've kind of learned over the last 6-7 years is that individual solutions they have the potential to be really high value, but they don't necessarily have what it takes to be a viable business, right? To scale, to market, to sell effectively. And so, I think most of the ecosystem has moved on from that. I think the other thing that, concerns me right now is a little bit that, there's a lot of investment chasing some really great brands around healthcare or digital. And I think that brand is really important, but that has to be backed by substance.
Okay, what do you mean?
Well, I think that in order to be defensible in healthcare, you've got to have clinical and economic demonstration of your ability to deliver on clinical and economic value.
Bill, name me some names here. What brands are you talking about?
I wouldn't. What? But I think that to build an enduring brand that's defensible, if you do that, and this is correctable in many business models, then by all means do that. And I think there's a lot of runway. If not, I worry, and I worry for those investors a little bit too, maybe.
All right, last words for you, for the health tech startups or the digital health startups, wherever we're calling them these days. Give them some advice. They're still in the game here. They're still looking for investment. They're still out there. How do they know if they're a feature in somebody else's platform or if they are the platform? And what do they do from here? What do you think?
Great question. I think that founders by far educate the investors of the world. So it's a little bit of, you're turning the tables here. But I think that, right now is a time to really invest heavily in your evidence and your strategy for go-to-market. Okay. I think there's a growing, here we are at AHIP, and the consumer more than ever is educated and informed about what it is that they need in terms of innovation. Mm-hmm. Being able to present it in their language now that they're more ready than ever, is a huge value, right? Whether you're going to a payer or provider or other parts of the system. So I think that that's the place to really
figure out how you fit into, if your customer is the health plan, figure out how to fit into the health plan and start speaking their language.
Yeah, and I think that 5-6 years ago that wasn't necessarily the case, but we're there now, by and large.
I think that's great advice. Just listen to Bill. All right, thank you so much for joining me. It was a pleasure to talk to you. Thank you so much. I'm Jessica DaMassa with WTF Health here at AHIP's Consumer Experience and Digital Health Forum. Thanks for joining us.